2017, 3 p.m. Eastern Standard Time, noon Pacific Standard Time. So just thank you all once again for joining us on our PFAN call today. We are elated once again that you took time out of your busy schedules to come and have this great conversation with us on today. Once again, I am Erica Speed. I am your resource contact for the PFAN network. I've been with the organization now for 4 months, so no longer can I consider myself the new kid on the block. I am excited about being on the call with you all today, so let's get zooming. All right. Oh, no. There we go. So just for those of you who are on the call today, if you were able to log in via Zoom, if you didn't do just the call-in option, if you could type in the option, type in your name and where you're from. All right, Sacramento, California, Bethesda, Maryland. We got Maine on the line. Oh, Mr. Andrews, Seattle, Washington. We got Libby from California. Melinda's calling in from Orlando, Florida. Okay. So it's good to know that we already know how to utilize the Zoom option. So if you have any questions, oh, we got some more California. If you have any questions, please do put your comments in that section, and Lindsay will make sure that we address those questions throughout the call. Please note that this is very informal. If you have questions, please either raise your hands or, like I said, put it in the comment sections, and we will go from there. Okay. I'm trying to get the screen to forward. All right, so I would like to first of all acknowledge that the PFAN network is fully sponsored by PFCC Partners. So I would just like to thank our partners at PFCC Partners for creating the PFAN network and fully sponsoring all of the activities, in which includes all of our hosting of the work groups, our virtual meetings, the newsletters, staffing, just everything that's involved with the PFAN network. We would like to give a huge shout out to the PFCC Partners, the staff there, and especially Libby Hoyt, the CEO of the organization. So you say, what's the PFAN network? For those of you who haven't been on our calls before, it's a network of thoughtful and thorough and prepared patient advisors who are grounded in an authentic partnership approach to co-designing policies, research, and care delivery. And those are the 3 buckets in which we fall under. So today we'll be covering on the call some community, things that are happening within our community. We'll definitely have our open talk where we'll have an opportunity to do skills exchange, and then many of our engagement opportunities that we've been awarded and or that have come to our attention. So I'm going to, without further ado, I'm going to start off with our first engagement opportunity, and we have Maria Abraham on the call from the Institute of Patient and Family-Centered Care. She is the Vice President of Programming and Publications. She's going to walk us through a pre-admissions checklist program or project that she's currently working on. So I'm going to turn it over to Ms. Abraham, and she's going to facilitate the conversation for approximately the next 20 minutes.
Great. Thank you, Erica, and I hope my sound is good.
I can hear you.
Yep. Okay, great. Thanks. Hi, I am really pleased to be on this call with this group of people. And I recognize a few names, so that's wonderful, but to everybody else, hi. So as Erica said, yes, I am at the Institute for Patient and Family-Centered Care. I've been here about 21, it is actually just 21 years, and I myself, my background is as a developmental care specialist working in newborn intensive care, and I have 3 sons. My third son actually had strokes in utero, and he required all the services that I had once provided as a professional, and helped me see the world I thought I knew from the perspective of a parent of a child with special needs. So I bring both kind of my intellectual side into the work, but I also bring, like you all, my personal passion to the work, and it's what kept me here for so long. But today I have a very specific thing to just provide an overview of. It's the pre-admission checklist, which I'll take you through just a little bit. And would love to just engage in an open discussion about the needs and the preferences of patients and families at pre-admission. And this is actually for scheduled admissions, and I'll speak about that in a little bit. So you have the context, but let me just provide a little bit of background for this particular tool and why I'm here today. So the Centers for Medicare and Medicaid Services, or CMS as we all know them, they funded 16 hospital improvement innovation networks last September. And those are all around the country, and they have the majority of hospitals in the country are engaged in one of the the HINs, as we call them. And this is the 3rd iteration of this particular project. They were called other things, and they've been developing over the last several years, but this work just started last September. And the goal is really to reduce harm in hospitals. And a key topic area for this initiative is patient and family engagement. And they have set certain metrics for all the hospitals that are part of this initiative to achieve. It's a 3-year, possibly 4-year project, but all of the hospitals have to report data and they are to achieve these metrics. Patient and family, or person and family engagement, actually, is what they call it. And one of the 5 metrics in this particular area is a pre-admission checklist for patients and families for those who are scheduled for admission. So they started with the scheduled admissions to make it a little bit easier for the hospitals to get on board and get started. And they want every hospital to provide an admissions checklist to the patient and their care partner before they come into the hospital, and then have a discussion with the patient and care partner about their thoughts and responses to the checklist. One of the key goals is to provide the message that the patient and their care partner or partners are essential members of the healthcare team, and they are encouraged to partner with the providers and staff throughout their hospital stay. And a good reason for this is because it's assuring the safety and quality. So they're trying to send that message that you're an essential partner. We invite you to partner with us, and we are, we have these common goals of getting you the best care and the safest care that you can have. The problem is when they wrote this particular metric, they didn't have any tools for hospitals to use. And so for these past 10 months now, and the prior iteration of this initiative, hospitals said, we don't have a tool, and you need to provide us with a tool and a process for discussing the tool. And that metric was written a little bit confusingly. So a lot of people thought that they were to do a discharge planning checklist pre-admission. And this was not the point of this metric. It really was to say to people, you're part of the team, you can partner with us, here's how you partner at admission and during your whole hospital stay. And yes, you will be participating in safe discharge home as well. So we are working as a subcontractor to the American Institutes for Research, who is a contractor for the person and family engagement part of the project. And we are working on developing this pre-admissions checklist. And so it is very beginning, it's very nascent, and we are looking for as many reviews before then. We have a number of hospitals who are going to pilot it and send it through another review process. So the background in developing this was pulling together as many resources as we could find that were related to this message and the kinds of components that we thought would be helpful. So we looked at 9 different resources, and then there were a few guides out there that were broader than admissions process. There's a great guide from the Louise Batts Foundation around, you know, how to partner in your safety. We have the Better Together campaign that looks at seeing families as not as visitors, but as key members of the care team. And then AIR has done some work and has talked to some organizations about, you know, what the best practices are. So we just came up with a list of components looking across all of these different tools and resources, and pulled out the components, the items that were most common and most related to patients and families as partners in safety. And we came up with this list that's on the left-hand side of the screen that Erica developed. Thank you. And these are the general categories of for the draft of the tool. And the tool is, right now, it's sitting at about a little over 2 pages, and it does not have the instructions for how admission staff would discuss and review it with the patient and family, nor does it have instructions for how to get this appropriately to patients and families. But these are the main items, and I don't want to read them out to you. I'm sure you can do that, but if you want to just take a moment to take a look at them, because I'd really like to get more your perspectives, if you've had experience with a planned admission, or we can talk about any admission at all, because I think probably many of us have that with ourselves or a family member, an admission, and how we might think about the kinds of messages, the important information that we know we have that we can share with healthcare providers that will help assure the safety in our care. So can I give you about 2 minutes just to glance at it, and then we can open it up. And this list has gone through, I should say, several reviews by patients, families, and hospital staff, some HIN key contacts as well. And I'll stop talking. So while we're still reading, actually I see a question coming in, but I think it's a really good question, and is advanced directives included in this checklist? So advanced directives was in this original list, and several of the hospital people provided feedback that the advanced directives, that process is that's part of their regular admissions procedure. And they said if you're trying to get a short tool that supplements what most hospitals have, then that was an item to take out. But I am, I'd love your feedback. If you think it's important to reiterate the importance of advanced directives, then I would argue for it to go back into this list. The timing for this, the review of this list is, we are hoping to have it completed and ready for piloting by mid-September. So we have about a month of review, and I'm happy that somebody brought up the review process. But I might be misunderstanding that question. So what's the timing for this? So if the timing, you're asking about the timing of when would a patient or and their care partner receive this, it would be in their pre-admission packet of information because this is for scheduled admissions. And so they would receive it that way, or they would receive it, some hospitals are willing to work with their community providers to provide it with their specialists or their primary care providers, whoever is overseeing the admission, and talk about it then. And so it would be, they would be given instructions prior to their admissions to review this list. And this is, what you're not seeing is the detail underneath each of these components. You're just seeing the major components.
For me to pull that up?
Yeah, that would be great. And so I like your idea. Somebody's just chatting in about advanced directives. Agree with you. Actually, best practice is to have advanced directives, primary care physicians prior to any surgeries, is regular part of their practice, talking to their patients about the importance of advanced directives. You don't want to wait until you need the advanced directive to go in. So we're working with the primary care practices, not as part of this project, but to start those conversations. So thank you for that. I think, yeah.
I'm sorry, can I just chime in, Marie? I would also just invite folks too to go ahead and speak up on the call, as well as using the chat box if you'd like, just to a little more conversation.
So I'm going back because there was something that I missed in a chat. Yes, so most of this is about the advanced directives, and I think that's a great idea. So it is a great reminder. After they receive this, they will be told to bring this with them to the hospital. This is not in the format it would be either, because it is just an initial draft. Yeah, interesting. And so they would be told to please bring this in, and an admissions staff will be talking to you about it. And some of these things will get documented in the medical chart, and so that if it's something about who's their care partner, who's their healthcare proxy, the advanced directive hearing, that would be a good thing to include in here. I'm seeing the note about when you'll be able to bathe and shower, and I'm working with 10 hospitals in New York area, and expectations like that are something that they've talked about. So that's a great idea as well. So yes, please unmute your phones and chime in, or I don't know how you do it, Erica. I don't know how you manage the conversation, but I would love for your feedback, or the other things that are really important to you at admissions.
So typically, team members would just speak up.
So, I have a little bit of a question. This is Libby. In terms of the areas around safety, I know a lot of hospitals that we work with are a little bit cautious about talking to patients and families about safety because they want to make the invitation for patients and families to get engaged in creating a safer healthcare environment, and at the same time, it's a little feels precarious to them to mention safety and the fact that there may be an unsafe condition in existing. So I'd love to hear from some of the advisors about, and I'm going to encourage you to speak right up again, but I'd love to hear from you about how does this resonate with you in terms of how organizations might speak with you about engaging in the safety of care?
This is Janice. I think it's important, and on the safety, just to be honest and tell a recent story, I was in the hospital in May, and I had an infection, but I wasn't really aware of it. I mean, they talked to me in technical terms, you know, your platelets have dropped, whatever. I was going towards septic, right? And I didn't really know that until I got out, and, you know, I came out of it very quickly, thank God. But they didn't, you know, they were doing all the normal precautions, but obviously the antibiotics weren't working, the ones they gave, and they switched them. So, and I moved into a single room, and, you know, you think I hadn't been in the hospital for a long time. I thought they were upgrading me, right? Well, no, that wasn't the case. So nobody really talked to me about that. And in retrospect, when you're sick in the hospital, even a care team member might not know some of this. They might, because they never said anything to me about it. And knowing that I was a very engaged patient, I don't think that they felt that they had to either, right? And I didn't ask questions. So it's important to ask questions. I think this list here on safety just about covers it all. I don't know. The side effects of treatment and medication also, you know, the fact that they're listened to when you have the side effect. You know, like this medication is making me feel worse is really important that they take that seriously.
Mm-hmm. Thanks, Janice. And you know, you are an engaged patient, and I'm wondering how you or others think about if patients who don't, you know, aren't used to advocating for themselves or being an engaged, activated patient, if people in the hospital start a conversation about how, you know, we're inviting you to be a partner in safety, and here are the things we want you to look out for, without causing concern and, you know, fear from the patient and family. We know there's a lot of patients and families who think that, you know, those words or the things that they're being spoken to about might cause great fear or anxiety. So I'm wondering, because this is part, I think, of how we are going to have to write the instructions for the conversation. I'm just wondering, how would you think staff could broach the safety conversation without unduly, you know, scaring people?
I just want to add, I know that there's been recent, see if they're projects or electronic projects where there's screens in the patient's rooms and they tell them, you know, they're able to be engaged with their care right there in the screens and talk with their doctors and other things, which is a wonderful, I think it's great. Some people think it's taking place of the doctor there themselves, but having that safety information there is important, because I think as patients, when we sign that release, we don't really read everything, right? I mean, we read it, but whatever, right? And, you know, just the fact that they realize this is two-way, you know, I mean, a patient themselves can cause safety problems, like, you know what I mean, going outside and smoking or what, you know, and maybe doing something else. They could have a mobility issue, whatever. And so the safety is two-sided. I think it's important to be aware, but if a hospital is on top of it, I think they will definitely understand it. And I think they have an obligation also to let patients be aware, right, of this. I don't think it should be.
Yeah, and Marie, this is Stephen Hoy. I'm going to go back to your question about how do you breach this subject with patients and families without scaring them right away. And I really get that because, I mean, for all the reasons, it can be scary when you expect your hospital to have the safest environment, and then they're approaching you to say, hey, help us make sure you're safe. But I think what this does here, especially the bolded top line, you know, your care partner, your hospital staff, we're all working together as a team, right, to make sure and giving them the invitation to speak up about things. I think if you're, especially in giving the invitation to speak up about things, you could be calming a lot of nerves. I know I've sat there scared to like, hey, is that supposed to be doing that? And you're kind of almost nervous to speak up. And I think that's where a lot of the safety issues regarding these lower topics may stem from, you know, that fear of speaking up. So I guess for me, it's a matter of my doctor saying something along the lines of, hey, I'm looking out for constipation in you. Can you help? Right. And as a side effect to opioids, and preaching that topic in that partnership sense that you've kind of laid out here. So I actually don't have any suggestions for improvement like it.
Okay, thanks.
I think this is Janice again, the last statement of family activated rapid response is excellent. That's something.
I think we lost Janice.
I'm sorry?
Oh, we didn't hear you.
Oh, I'm saying the last sentence, the family activated rapid response. And if something does not seem right, is an excellent comment that this is something the families could discuss beforehand. You know, I think it's excellent.
A lot of hospitals don't have that. Oh, I'm sorry. Go ahead.
No, I think you're about to pick up on what I said. Go ahead.
Well, we have heard from a number of hospitals that they don't have family activated rapid response. They have the rapid response team, but they have to, the family care partner has to go through the staff to call the rapid response team. So, you know, this is kind of a nudge to hospitals to consider family activated rapid response. There's certainly enough information about it out, how to do it and do it effectively. So, you know, we are trying to nudge hospitals. But Erica, what were you going to say?
No, that was my feedback as well. Is I don't want to set someone up for failure that is considered an expectation, but what if I don't actually offer that service currently? But I do like the fact that you are nudging them into that direction. I want it to be, I would prefer something that's more inviting, like inviting me into it versus me feeling like I'm being pushed into it. But when I read it, I'm like, some people will be like, what does that mean? So.
Yes, and the tool, one important feedback that we've been getting as this has gone around for reviews and you know, again, it's not in the tool format yet, but to make this tailorable, so to make this document hospitals can take this and individualize it. They can brand it, but also, for instance, if they don't have a family activated rapid response, they could keep the, you know, getting that rapid response team. But this, again, we are trying to prompt us as a safety mechanism and as an evidence-based mechanism. So.
Erica, I was just going to ask you, Erica, if you would move down to a little bit to the next piece. Great.
And so this is again, there was confusion. Were you talking about discharge pre-admission? And this is separate from the discharge planning or the discharge checklist. There is a discharge checklist. It's just that most hospitals, many hospitals, have a discharge checklist. But what we wanted to do was while this is not a discharge or transition planning checklist, we want to prepare patients and families for the next stage. So this, while it is a pre-admission checklist and things to think about while you are in the hospital and how you can partner, here's how to prepare for that last part of the process or the pathway, which is going home. And here's some of the major things to consider, and that you should expect that the staff and the providers on the care team are going to be talking to you about. And if they don't, you need to be, you can bring them up as well. But that was the point of having a piece on discharge in this. So what are people's thoughts about that? We really don't want to confuse patients and their families. Yeah. Mm-hmm. There's a note that the major thing for discharge is how the patient's going to get home, and I completely agree with you, and we have transportation needs included in there. Thanks for that. I think another thing, for instance, I know working in the newborn intensive care and then having an infant who needed to go home. He's an infant, he's a newborn infant. I knew what they should have told me about follow-up appointments and all the different people that now I needed to start seeing in the community because I knew it, but nobody told me about the reason for, if they gave me contact names and said you should follow up with them and you should follow up with them. If I just went home with my baby, he actually was quite okay until 4 months. That's when a lot of his issues began showing up. So I might have just gone home and never made those calls and never gotten him the help he needed early. So we hear this with adults. They don't know why these referrals are being made for the follow-up appointments. They know that they have to go back and see their primary care doctor or the doctor who, admitted them to the hospital. And then there's another question here or comment about, yes, the medication. I think that's really big. And so, and it's not on here. And it is about the list and instructions about the medications and how to take them properly. But if I'm reading this chat correctly, it looks like getting the actual medication to be filled so that there is seamless and uninterrupted medication management. Yes, so there's a great question. Thank you. It was going to be my last ask after this conversation's over, to get a copy of the checklist so that you can review and comment later. I would love that. And Erica and Libby both have the tool, and please mark it up to your heart's content and send it back to me in the next 2 weeks, and I'd be really happy to look at all the feedback.
So absolutely, for those of you who are interested, just send an email to Erica at pfccpartners.com. I'll send you out the checklist. I'll compile all of them, and I will send them both to Maria and Libby in one email collectively.
And we can also post them to the website, post the checklist to the website so people can draw it down as well. And others who weren't able to be on the call, I know have already been asked for the recording a couple of times. And again, I just want to reframe just a little bit because I'm with Marie. There is so much confusion out there about this admissions checklist being a discharge checklist. These are the questions and things that we want to be thinking about before we even enter the hospital about how we're going to manage when we go home. So I, in particular, my favorite bullet on this one is the care coordination after your hospital stay. I think that piece, and if I know how that the information about my hospitalization is going to be communicated to my specialists and and primary care, then I can follow up on it. And I think that's a really powerful opportunity versus, not having any idea if those communications are happening, how those communications are happening, no way to follow up on it. So I think that's, and thinking about it as you guys go through the checklist in detail, I would certainly, appreciate it's what information do you need at admissions so that you can have not only the best, most highly partnered care experience, but also have what you need when you're going home.
Well, if anyone else has a comment, I'm happy to either hear your voice or see a chat, but I know that I've gone a little bit over on the time, so I want to be really respectful of your time, and you have other things on your agenda to talk about, but I look forward to any feedback and comments and whatever you would like, or even not just on the checklist itself, but how you might envision this being discussed with you. Any great ideas for that. All right.
So I would just say, Maria, if you could put your email address in the chat box.
Sure.
This month we had a lot of people in the chat box. I should have said speak up more, but thank you so much, and I'll make sure that I type up the questions and reiterate what your answers were to all those questions for those who weren't on the call today. But thank you so much for joining us today. Does anybody have any last-minute questions for her before we continue on with our agenda?
Great. Well, thank you all very much. And thanks, Libby and Erica. This was a great opportunity.
Thank you, Marie.
Oh, thank you.
All righty. Bye-bye.
All right, so we're going to continue on with our other external engagement opportunities. So we've already spoken about the Institute of Patient and Family-Centered Care. That's what we just had Maria on the call. Last month, recall, we talked about the 100 million healthier lives. There were 2 work group opportunities, the health and well-being matrix development and the health and well-being measurement implementation work group. So I didn't hear from anybody that stated that they had any interest, but if you have had an opportunity to go out to our website and review it in more detail and you're still in fact interested, please send me an email in reference to that. When it comes to IHI's National Forum at the end of the year in December, recall that the Jim Conway Scholarship is still open. So you can submit that application all the way through September the 15th to see if you have been selected to receive one of his scholarships to attend that conference free. The next one is, remember on last month, we also had Courtney Roman from the National Partnership for Women and Families. She presented on the call in reference to some research opportunities that she has been working with the CORE. I do know that we had one patient advisor that reached out to her. That was Joan Maxwell. If there's anybody else who has interest, please do let me know so I can get you into contact with Courtney. If you're unfamiliar with what I'm talking about, please note you can always go to our website and either go back and hear her entire presentation or give me a call or send me an email and I can share more detailed information about that one as well. Now, the newer one on here listed today is the National Academy of Medicine, or what we consider NAM. That's the NAM Patient and Family Leadership Network. They like to engage national patients and families to serve as effective leaders and advisors for the NAM and help them to achieve better culture, better care, better value, and better health for all in the healthcare system. So some of their opportunities will also be getting placed on our website before the week is out, but they have opportunities in regards to digital learning collaborative. They have an evidence development and use in the learning health systems. They have the care culture and decision making. I'm trying to think off the top of my head. I'm sorry. decision-making innovation collaborative, that's what it's called. Yes, sorry about that. So they have a lot of opportunities there where they're wanting patients and families on a national stage to get involved. There's different focuses when it comes to these. So please do go to our website. They have opportunities regarding optimizing the strategies for clinical decision support. So even if you're on the clinical side, or you're on the techie side, or value and systems, evidence-based, they have a lot of opportunities. So we welcome you to go to our site. I will tell you, when you go out there, a lot of these meetings, they initially started like maybe back in February or July, but if you click on the events page, there'll be a hyperlink on our website where you can find out more detail about all of these network opportunities, okay? So then, I didn't know I had went to the next slide. So then our internal engagement opportunities, of course, you are already a part of the PFANetwork virtual meeting call. You guys are on that call today. This is always the second Wednesday of every month at noon Pacific Standard Time. Thank you all for registering to be on this call today. Tomorrow, we actually will have our quantitative work group meeting. So we're really wanting to recruit more people to be involved. If you're interested in learning more about quantitative data, about discharge checklists, just you have a research mind or a gift, please do just get involved. You can just jump on the call, see if it's something that may interest you, but we really need more patient voices on the call. Currently, there's myself, Libby, Lindsay, a lot of personnel from the PFCC partners community, but we also have Melinda, but we would really like to have more patient advisors to express interest on that particular work group.
So Erica, can I jump in here for just a quick second?
Absolutely.
I am not a researcher at all in any shape or form, and anyone who knows me knows that. And so I just wanted to, that qualitative work group, I feel like the title is somewhat intimidating in some ways. It's not something I would have considered myself in, but thanks to Melinda and some other great minds in helping me to understand the research world a little bit. Qualitative is different than quantitative. Quantitative is numbers and how do we get those trends. And qualitative is really storytelling. So what we're doing in that group is preparing to gather some stories around the discharge process, so that we can compile some themes around what's really needed for the discharge process to inform the work going forward across landscapes, across healthcare settings. So I didn't want anybody to be intimidated or put off by the title of qualitative work group. We should have probably made it stories. But that's essentially what we're doing in that group. So no need for any research background whatsoever to participate. Thanks, Erica.
Thanks, Libby, for that that clarification. And then also our third work group is the patient access work group, and we are trying to just mobilize patient and family advisors to support the implementation and adoption of open notes. This is a huge initiative that we're working on. We have a call to action where we're asking the patient advisors, you on the call, those who we encounter in other settings, to either write a letter or send an email to your members in leadership, your chief operating officer, your patient experience directors, VPs, your chief medical officer, and ask them, do we in fact have open notes at our organization? And if they do, see how you can help to support that and bring about awareness throughout your entire systems. We have some people who have stated, yes, we have open notes, but it hasn't been, advertised where all the patients know that they had access to those open notes. And if you don't have open notes, Libby has already shared some information with a few other patient advisors in regards to some material that you can take so you can better explain what open notes in fact is, and you can be better able to articulate what open notes is all about. And if you have it, if you just adopted it, we would greatly appreciate if you would just share that information back either on this platform. You can send myself or Libby an email, because we would love to know more about how you all are utilizing open notes at your facility. And for those of you who aren't familiar with open notes, it's pretty much an opportunity for the patient to have full access to their medical records. And you know, when you have access to your medical records, it changes the conversations between the care providers and the patients or the caregivers. Did you have anything else you wanted to add to that one, Libby, before I continue?
Yeah, I did. I thought, you know what, if you guys could all just type into the chat box whether your organization, who your organization is and whether they're using open notes, it would be great for us to know. And I did want to mention Marianne had a great question. Marianne, it's just so great to see your name in here. In terms of how to join the work groups, please just send Erica an email and we'll get you on the mailing list for those. The other way is through the PFAN website. Those calls are listed on the website, as well as notes and agendas for those meetings, so you can find all that information there.
Okay. All right, so we're going to shift gears for a few moments. I only need about 2 minutes at the end to share some announcements, but we're going to shift gears. I do know that we spent a little bit more time on that opportunity with Maria, but it was definitely needed. You guys had great feedback, but we're going to stop for a moment just to have an open talk. So let's talk about any success stories that have taken place in either your organization, your hospitals, or in whatever capacity that you are a patient advisor. Let's talk about some success stories, and then let's talk about any pebbles that may be in your shoes, any projects that have really, you haven't had any traction with, you haven't really been able to get over that hurdle. There may be somebody on the phone who has experienced that pebble, and they've been able to get rid of it. So now it's open talk, and we would like to have everyone to provide any and all feedback that you would like. And I'll start with, is Jennifer on the call? I know last month she had questions about meal tickets and or vouchers where family members did not have to leave the bedside with their child, that the meals could be brought up to the bedside with their child's meal. Is Jennifer on the call? Okay. So I'll leave the floor open for anybody else who would like to discuss success stories or pebbles in their shoes.
Or even what your PFACs are working on. It would be great to kind of get a sense of what's going on out there.
This is Janice.
I do know a lot.
Go ahead. If somebody else, I was just going to talk. If nobody else would, I'm here. Go ahead.
Go ahead, Janice. That'd be great.
Okay, this is Janice, and our, I know I've mentioned it, a few of you have heard about this. We do have open notes in our EPIC system at Kaiser that used to be Group Health. That was, I made a little adjustment because it's now definitely Kaiser, has been Kaiser since April, but we've had open notes at Group Health. It was previously Group Health, now Kaiser, for many years, but they kept it quiet. They anticipated 1% of the patients utilized open notes, and probably they were doctors themselves, right, that knew about it. A lot of them are people engaged in research. And so now what they do is, I had a recent appointment and they mailed me an email stating you have open notes, and probably a lot of people, they didn't explain what open notes were, but shared how to find your open notes and your after visit summary and click on notes. And it also ends up in our patient portal. So there's 2 outreach efforts that Kaiser has done so that all the patients are now aware of how they can utilize their open notes, which is really exciting. So also we do have what's called a senior caucus at Kaiser, and it's just really being developed, but it's the first time in the Kaiser field that they have something of this type of engagement with patients that are seniors. And we've had a senior caucus for many years at Group Health. It was the only group that they determined they were going to send forward into the, keep going continuous through into the Kaiser. And we're now developing how we can work together on that to be advisors within the, within the system, that the board, and how we can all interact. We're just working all those details out now. There's a new advisory board that's being created since it's now Kaiser. I did not apply for that. I thought I'd wait a few years and see how it goes. But that's, the open notes is very exciting that we have now. Everybody can, it'll be interesting to hear the research that comes out of that.
I was going to say, I know during those summer months when children are out for school or people are taking vacations, a lot of patient advisory councils don't meet over the summer. But now that school is back in session in some states and are about to pick up in others in the next week or two, does anybody know what the initiative will be on your next agenda moving forward with your August or September meetings?
Hi, Erica. This is Joan. And at John Muir, we did not meet this summer, but I think we have a meeting coming up in about a month. But what we're working on is pain management. So the pain management team came and asked for feedback from the patient advisors about perhaps offering some alternative solutions for pain management, which our advisor group was super excited about. The idea of aromatherapy, acupuncture, those types of alternative pain management. So that's something that we're working on. I think I may have mentioned that we also worked on getting refrigerators into our mother and baby rooms so that families could have, food, enough food for new moms who are nursing and the food they want. So that was approved as a test, and those refrigerators are going in. So that's good. And then we haven't really started working on this, but we've identified it as a need, and that is to discuss the role of hospitalists. There's a lot of, I think, frustration and confusion on the part of patients, and maybe even somewhat on the part of nurses and doctors, of how to all work together to provide the best possible information to patients. And there's a lot of confusion with patients as to who hospitalists are, what they do. There's a different one every day. It's frustrating. And so it's something that our patient group has identified as an opportunity to improve the communication around hospitalists. So those are just a few of the things we'll be working on.
Thank you so much for sharing.
That's great, Joan. I know that that confusion around hospitalists is so pervasive. So anything that you learn through your PFAX efforts, I'd love to hear about and help spread, because that truly is kind of a universal confusion out there.
Absolutely. I will definitely share it if we come up with anything that will help it. I don't want to say that I'm not optimistic, but I feel like it's a very big thing to tackle.
Yeah.
And that it's not easy, because there's a lot of kind of the old world colliding with the new world and figuring all that out. So I will definitely report back when we're a little further along.
Great.
Okay. Well, in the interest of time, what we can do in the future is maybe have a knowledge cafe where we have a whole meeting catered around specific topics. So I'll be reaching out to you all and trying to come up with some polls for future virtual meeting to see what are those top, discussions or topics that we want to discuss. And during the knowledge cafes, we can take a deeper dive on just one topic, so we can all talk about, something related to the hospitalist or the senior caucus, or how we can engage people with a holistic approach to pain management. So I would just like to thank everyone. I just want to give you some more exciting news. I know we only have about 60 seconds, so I'll try to go as fast as I possibly can. Please don't forget that the PFAN now has its own website. The website is listed there. You can go there and you can find out all of the information about the PFAN. We have a lot of resource information out there. We actually record the virtual meetings, and we have our group. Our work groups minutes are located there as well, so you can get a better understanding of what's taking place in the community. If you haven't already done so, please join the PFAN community. That's where you'll be added to our mailing list. You'll be sure to get all of our save the dates and things that are also taking place. What's really exciting that we've also implemented in a short period of time is some additional social media outlets. We've already spoken to you all about Smart Patients, and that's the platform where there's peer-to-peer support. But we have most recently added a Twitter account for the PFAN, and that handle is considered the @network PFCC, or you can follow us on Facebook, and that is PFA Network. So please, if you can, we're just trying to meet people where they are. Some people don't check emails a lot. However, on their phones, they have apps so they can get to Facebook, or they can get to Twitter, or they can get to LinkedIn. So please, if you can, go either like us on Facebook or follow us on Twitter, and that'll give you an opportunity to also know what's going on real time. When we're at conferences or we're involved in things, we'll be tweeting what's taking place in the community. If you go to our Facebook page, we'll also be listing some of our opportunities there, as well as also having our invites for the different work groups, as well as the virtual meetings. So I thank you all once again for joining us on the call today. Once again, we cannot thank you enough for taking an hour out of your day on the second Wednesday of each month. Thank you all for collaborating and just sharing information with one another. If there's no other questions, I'll stay on the call a few more minutes, but thank you all so very much. Next week, you will be receiving your newsletter directly to your email. Thank you.
Thank you.
Thanks.
Bye.
Thank you.
Thank you. I'll stay on a few extra minutes in case anybody needs anything.
Eric, I just sent you an email. I was curious about the IHI. Is it a scholarship to the conference, or what you mentioned a few screens back?
Yes, it's an application. They're picking, I'm not sure how many patient advisors they'll be selecting. But it's an application for a scholarship. I'm sorry. Yeah.
Okay. Right, I couldn't find it. Is it on the website, or?
It's actually it's the Jim Conway Scholarship, and that's given out to one patient family advisor.
Okay. And how do we find it on their site?
Yes.
You said you just.
Yeah, I sent you an email, but I tried looking on their site and I couldn't find it. But maybe if I look up Jim Conway, I might be able to find it. And then,
I think it's on our website as well.
Okay, I looked, but I was on my phone, so it might not be. I couldn't, might not show up there. And so I just wanted more information. So these 4 engagement opportunities, I looked at the engagement on PFCC. They should all be listed under there.
On the PFAN.
Okay. Great. Okay, PFAN. And then I just want to mention that tomorrow I'm going to the Million Hearts Initiative with its CDC and the American Heart Association are putting out. And so they're going to different states and looking for individuals that are interested. I think it's primarily targeting or hoping for physicians and people at the state and local jurisdictions that are involved that can help prevent heart disease, awareness and prevention. So it's a federal CDC and American Heart Association initiative. But 2 of us from the senior caucus will be going to that, so I can provide some feedback on that later. So I don't know if you were aware of that initiative, but
Yeah.
else. Yeah. Okay.
Great, and we appreciate the contributions. I mean, I think that's, you know, what these calls are really for, is to share. It's not for us to give you guys, it is for us to give you some information and background and engagement opportunities, but it's also a time to connect as we build the national patient family advisor community.
Right, I appreciate that. So, and like, you know, I was more involved with clinic than hospital, but I also am involved with a patient, a PFAN at, for the University of Washington, but that's really research oriented. And I appreciated you sharing about qualitative versus quantitative. A lot of people don't know those nuances. So that was a good clarification. Thank you so much. I'm checking off now.
Okay, thank you.
Thank you.
Okay, Lindsay, I think we can discontinue the recording. And thank you so much for all you do.
Sounds good. Talk to you later.
All right, talk to you guys later. Bye-bye.